Good afternoon. And today I have pleasure of interviewing Dr. Miho Urisaka. She is a doctor of physical therapy, but she specialized in fascia. Good afternoon, Mika.
Good afternoon. Thank you for having me.
And in today's conversation, we're gonna talk about fact what body doesn't recognize specialties, and tongue doesn't belong to the dentist, speech therapist, or sleep physician. It's actually part of that intricate mechanism, and diaphragm not only part of breathing but also posture and digestion. And in my book Breathless, my heroes actually looking for answers. They trying to look at other parts of the body to solve the problems what they immediately have. So can fascial restriction cause jaw pain, sleep problem, digestive issue, bladder symptoms, and chronic pain? Also, we're going to talk about this big mystery of modern time, Ehlers-Danlos Syndrome, what actually happened through connective tissue. And in this episode, we're going to talk about fascial counterstrain, visceral manipulation, TMJ and jaw pain, airway health and posture, bladder and digestive dysfunction, chronic pain and brain fog, connective tissue health, nutrition and inflammation, especially our guest on a Green Hill farm, what she supplied her patients from farm to table, produce what she grew herself. And we're going to talk about whole body approach to healing. And usually I talk about how I met my guest. So I met my guest through another guest or a personal friend, through Samantha. She is behavioral optometrist, Dr. Samantha Zlotnik, on her birthday. She celebrated her birthday inviting all wonderful, unique specialists in one beautiful space, and we have chance to communicate, network, and eventually form collaboration. But Dr. Miho Urisaka, she's a doctor of physical therapy. She's certified, board certified orthopedic clinical specialist, and she is one of 50 fascial Counterstrain practitioners in the world. And she has a lot of teaching affiliations, so she shared her knowledge with a lot of specialists, and her clinical approach is treat the body as one continuous facial system. And I think the best way, if we start with a question. So please tell us, Miha, what exactly fascia is and how you view body health through that intricate system.
So, Maria, thank you so much for having me. It's really nice to be here. I'm excited to talk about fascia. I think it is starting to get a little bit more mainstream knowledge and recognition, but really fascia is everything. And so we used to think of fascia in PT school as the stuff between your skin and the muscles that you dissect out and you throw out so that you can see the muscle and you can see the nerve. But it actually turns out that the fascia is everything. So the fascia covers the muscle, of course. The fascia covers the nerve. The fascia covers the artery. All your organs is fascia essentially. And so fascia is integral to every intricate part of your body's anatomy. And so when you have, I like to explain it like a baby, maybe you have a baby wearing a onesie, if you pull on the toe of the onesie, it's going to create a pull in the head. And so you can't just isolate one section of the body because of this interconnected tissue that we have in our bodies.
So I want to ask you about one disease. At least I'm sure there are, I see a lot of disease where fascia get involved. But now, all of a sudden, a lot of people been diagnosed with Ehlers-Danlos Syndrome. And people experience pain, fatigue, pain in the jaw joint, digestive problems, dizziness, sleep disturbance. Like they become, they're like a whole system. But people who have that syndrome, at least what I know, they're very flexible. And I used to think, but flexibility is a plus. Like they can take the thumb and do it this way. They can do that with the elbows. What is that Ehlers-Danlos syndrome and why so many systems are affected?
So Ehlers-Danlos syndrome was first known about with hypermobility. I've worked in the dancer population, and so when you have that hyperextension of the elbow or hyperextension of the knee, it's considered beautiful and beneficial. But what it really is actually a component of various connective tissue disorders. And so generally, when we're colloquially speaking about Ehlers-Danlos or EDS, we are just talking about, often just talking about hypermobility in the muscles and the joints, but this connective tissue disorder can happen anywhere. So again, fascia being everywhere, this connective tissue disorder, if it occurs in a muscle or a ligament, then it is going to show up as a hypermobile joint, or some people call it double jointed, but it can also occur in your organ systems. It could also occur in your vascular systems. And so this connective tissue disorder in your vascular system, for example, could mean that your veins and your arteries are stretched out. So people have varicosities and venous dysfunction in their legs and swelling. That is a component of connective tissue disorder. If you have this connective tissue disorder in your organs, then you're going to have more digestive issues, have slow motility, all of this gut dysbiosis and digestive IBS type symptoms. Those are another component of connective tissue disorders. And of course, this can go all the way up into your brain. If you have a vascular symptom where, for example, your jugular vein is affected, then the blood flow out of your brain is going to be impacted, and that's going to have an impact on brain function. It's going to have an impact on dementia and Alzheimer's. And so EDS is a common colloquial name for this vast variety of connective tissue disorders that can affect the musculoskeletal system, but also affects every single system that you have in the body.
Then my next question, how you address it, what you can do to help people who really, in a young age, they function, but you can foresee what's going to happen with the time. And they function but suffer, but you can predict a lot of adventures in the future.
Yeah, so one of the things that we do at my clinic with EDS and with hypermobility in general is that we actually treat them the way we treat a lot of our other normal orthopedic patients. And so what we're doing with the fascia and what we're doing with our technique is we're releasing the tension in the fascia, right? And so the easiest way to talk about it is maybe if you talk about the spinal column, the spinal cord, if you have a restriction in your cervical spine, in your neck at C6 and C7, then that joint that's responsible for movement is no longer doing its job. So that means the joint above it, C5, C6, is going to have to move extra to compensate for that C6, C7. So this is a common issue that occurs in the low back. Everyone has L4, L5, S1 herniations. That's because that's a hypermobile segment, but the important part that it's in relation to a hypomobile segment, either above or below it. And so what happens in the case of people with excess mobility, with hypermobility, is that when that C6, C7 stiffens up, that C5 is already weak to begin with because of the laxity in their ligaments. And there's extra pressure placed on that C5, so it makes them even more susceptible to injuries occurring at that level. And so what we do with our treatments is that we increase mobility to C6, C7. We decrease the pressures on C5 by increasing mobilities in the adjacent segments. And so that's how we look at the body as a whole. And so again, with the EDS hypermobile population, what we see is people have very common restrictions. For example, if you have an injury, you have a concussion, you have a fall, you have some sort of impact injury, something in the body tightens up to protect that injury. So that means that area that's tightened up, the area next to it is going to be more susceptible to injury. So for example, if that's in the ribcage area, if your heart, lung, this central ribcage area tightens up, that's going to make you more susceptible to a shoulder injury. And so we can see this in a general orthopedic population, of course, but you just end up seeing these injuries occurring earlier in life for people with hypermobility because their compensatory mechanisms aren't as robust as somebody who has a more intact ligamentous system.
This is amazing. Like, this is actually opposite to what I see in my practice. Most of the people who I see, they are actually tight. They actually, they have restrictions, like vice versa. I never thought about looking for area what actually super loose, or at least my eyes were closed. Like, a lot of things I learned through my program and I start applying in the real life. So I want to ask you the questions. Okay, Ehlers-Danlos population, I don't diagnose people with Ehlers-Danlos very often. I had some examples, but what I see as a dentist very often, situation with the teeth, with the bite, what fascial relationship between jaw and the tongue, neck, diaphragm, pelvis, what dental professionals should understand better. So thank you very much to my audience, people who want to get educated about fascia, and if some of them happen to be medical practitioners, I want you to look through the fascia eyes. So please give us recommendations. Problem with the jaw joint, how to look through the fascia. A problem with sleep apnea, which not too far from each other. But what's your view through the fascia lens?
Absolutely. So I'd like to start off with a very basic understanding of the pressures in the human body and the human system. We all talk about core strength, right? We have to talk about, making our core strong, working on our abs. The reason why this is so important in TMJ, jaw health, tongue posture is because if you think of the body as like a Coke can, where the pelvic floor is the bottom of the Coke can, the walls of the Coke can are your abdominal wall, your intercostal, your oblique muscles. And then the top of that Coke can is the epiglottis. And so when a Coke can is closed and full, it has a lot of strength, right? But when you pop open that top, then you can crush the Coke can. And so any puncture or any weakness in this entire system collapses the Coke can entirely. And so when dentists are finding jaw clenching, tightness in the suboccipitals, tightness in the upper traps and scalenes, this might actually be a compensatory hypomobility compensatory spasm of the cervical region because of a weakness in the pelvic floor. And so lots of people, massage, trigger dry needling. A lot of people try to go at the thing that is tight. They try to inject, for example, or massage the upper trapezius, but without looking at why the upper trapezius is tight. What is the upper trapezius trying to protect? What are the scalenes compensating for? You have to create strength and proper function in that structure that it's weak before the body, the neurological system, will allow the neck and the jaw to relax.
But how you, with your remedies, your methods, treatment philosophy, can strengthen the core? This is a very specific question because as the doctor of dental sleep medicine, my patients use chest to breathe. And I can see it over and over and over. I usually ask them how you should breathe. How do you breathe? People said, I never think about it. This morning, I met with a wonderful patient, and she's my patient already for 6 months. And she asked me that question. So how should I breathe? Should I use my nose or should I use my mouth? And she's already in treatment. So I realized I'm not educating well enough. And what I learned, of course, if you don't use your nose, you don't use your diaphragm because it just doesn't work. If you use your mouth, it's going to be the chest. If you use your mouth sometimes, it's going to be the chest anyway. Because to get, constant training through the diaphragm, you have to be very, very conscientious about that type of breathing. So how do you approach strengthening the diaphragm, or at least showing the people how to breathe? I talk about that in my book,
Yeah. So I would say that, again, my philosophy is a little bit more about mobility and creating mobility so that the body can utilize its natural mechanisms. And so a great example, I had somebody come to me. She has POTS, so that's postural orthostatic tachycardia. Every time she, gets up from a supine position, she gets faint. Sometimes she faints, and her heart rate is maybe 120 at sitting at rest. This is a common patient population within the EDS spectrum. And she came to me with tightness in her upper traps, really tight scalenes, headaches because of the tightness around her neck. And so after assessing her, you can see that she breathes into her shoulders, right? She uses her accessory muscles to breathe. And the first thing that we did for her was we released the tissue around the pericardium. So if you think about the heart, the heart is sitting inside the rib cage. And the heart's not just floating around inside the rib cage. The heart is anchored to the vertebral column, to the sternum. It has all of these ligamentous attachments, these visceral attachments to your bony structure, to your rib cage. So if your heart and the ligaments around it contracts, that means it pulls the rib cage in with it. And so now you have a really tight rib cage. And even though your lungs are trying to expand, you're using your intercostal muscles to try to open up the rib cage, the heart is pulling it in. And so what we did with her on the first session was we released the fascia around her heart. We unwound her heart, separated it from her sternum, separated it from the posterior vertebral column, so that her rib cage has this anterior-posterior ability to expand. And then that allowed her to take a deeper breath into her chest, which then allowed her diaphragm to drop, which then started to train her brain that she doesn't need to use her accessory muscles to be able to breathe.
But how do you release the heart? You can't have access to the heart. How you do that?
We do. So this is all manual therapy. We do this all with our hands. And when we massage a muscle, we are never, ever breaking up the tissue. Everyone talks about like massaging out a knot. There is no way we can do something to the body that the body does not want. And so anytime we use touch, we're working with the neurological system. We're actually showing the body that this is a safe direction to move, so that the body itself releases the tissues and tension in the tissues. And what we do with Counterstrain, not to get too far into the details, but there's inflammation trapped in the interstitium. There's cytokines and other inflammatory chemicals that create this situation where the fascia contracts in reaction to that inflammation. And so what we do with Fascial Counterstrain is we decompress the tissue to allow the inflammation to drain out. Once the inflammation drains out, the neurological systems and nociceptors then don't have to fire, and that allows the tissues to unwind and relax. And that is how we access the tissue around the heart, the pericardium in this case, to create more breathing in the rib cage.
Actually, you educate me about POT, and I do have, somebody who was close to me with that syndrome, and the symptoms you describe as an increase of blood pressure in a very young age. I really wish that person is listening to that program. What besides the medication, it can be some other ways to address this tachycardia and increase of blood pressure as a compensatory mechanism for the inflammation and the tightness of the tissue around the heart. So then maybe that would help. So that's a very interesting topic. But now, my last question, I want to ask you about the farm. As I mentioned to you before our interview, I devoted several chapters of my book, Breathless, to the modern food culture. And I interviewed some nutritionists food scientist on my channel. That's very close to my heart. I was raised in a very different society, and how we approach the food, and then everything from the West, fast food or this crunchy, bright, bright coloring food was a very appealing to me. But then I moved to the United States. I learned what exactly it is, and I do see the effect of that marketing strategies on the health of my patients. So in my book, I try to bring it through the story, how difficult it is to change the philosophy, what's actually pleasurable and healthy in the same time. So that's very hard. So please tell me how, why you start the farm and how you look at the nutrition and recovery and connective tissue health and healing through the farm owner perspective.
Absolutely.
Or food, like food farm to table philosophy for your patients.
Absolutely. So one of the things that we discovered with all of this fascial work is that you can't help somebody with fascial work who is consistently inflamed. And so this is one of the reasons why it's important to work across specialties, because with, for example, the EDS population, I know that fascia treatment alone is inadequate to deal with their hormonal, their inflammatory systems. And so I do collaborate with physicians to, that prescribe them medications to deal with them on what I call the chemical side versus the mechanical side, the chemical side. And so what happens with the farm and nutrition is what you're putting into your body, if that is also creating inflammation, then that number one increases the amount of inflammation in your body that causes these fascial contractions. But number two, it basically anything that I do when I clear out an inflammation in the gut, for example, that patient, if they come back with a gut dysfunction, I'm like, you ate something that inflamed your system again, and we can just keep doing the same treatment over and over, but you're not going to progress. And so early on, we discovered the importance of inflammation within the body to take care of that. And I have to say, so I own a chicken farm. We have pasture raised hens. We have about 500 chickens right now, and we bring, we bring the eggs to my clinic. It's, eggs are just one part of the food system, obviously. Just eating my eggs is not going to all of a sudden decrease your inflammation, but what it does do is it starts the conversation. When somebody asks, why are these eggs different from others? Then we can start talking about the American agricultural system. And honestly, I think agriculture and food science and farming has the same problems that the medical system with insurance and hospital has, where we're going more and more into larger corporations, hospitals and doctors all being under the same system that then control the narrative around what medical care looks like or what food is. And then the quality just honestly decreases. And so what we do at our farm, we farm in such a way that the chickens are happy and healthy. They are running around on wood chips, actually, because that is actually the natural way that hens live in the woods, nesting on trees. The way our farm system works, we are increasing our nutrition back into the soil, so we're not extracting from the earth. We don't use artificial lighting systems to force the hens to lay all year. So our hens don't lay in the winter. They don't lay around that December 20th period where the days are the shortest. And so by integrating various aspects of health, so talking about movement and speaking about nutrition and speaking about living with the cycles and living with the seasons, I believe that all of that is interconnected into how we become healthy as human beings. And so these eggs are, of course, great. I have had a couple of patients tell me that our eggs don't activate some of their histamine reactions that some other eggs do. But more than that, it is a tool for me to be able to speak about, start talking about looking at ingredient labels, start asking questions about where your food comes from, start asking about what chemicals have or haven't been used and how fresh this food is, or has it been kept in a warehouse. in artificial conditions, or has it been bred to withhold long shipping rather than nutrition? It just opens up the avenue for me to be able to speak with these topics about my patients.
I love that topic about it. But so the name of your farm is Cucumber Farm, but you don't grow cucumbers.
No, Cucumber Hill. Uri, it's my last name. Uri is the name for like melon in Japanese. So like Kyuri is cucumber, and Saka is hill. So Urisaka is actually why we named our farm Cucumber Hill.
Got it. So, my wish to my audience, what we look at nutrition a little bit different. I don't grow chicken, but my grandma did. And she actually raised chicken in a bathroom. We live in an apartment, so in Russia, she raised it in a bathroom closet, and it was a lot of fun story related to that. But she had a passion for chicken. But now, looking at you with the chicken, it's wonderful. The attention to nutrition, I highly value. So my wish for my audience, no fast food. That's my wish. Thank you very much, Miho, for sharing your knowledge. And we're going to give the information to your social media channels. I recommend my audience to follow you on social media and pay attention to the fascia. And if you want to have a holistic approach to health, visit Dr. Miho in New York. Thank you.
Thank you so much.